Hello and welcome to this Cancer Grace webinar. My name is Bhisham Chera. I'm an associate professor in the Department of Radiation Oncology at the University of North Carolina School of Medicine in Chapel Hill, North Carolina. I'm also the associate chair for clinical operations and improvement and the director of patient safety and quality in my department. I have expertise clinically and academically in treating and doing research, treating head and neck cancer patients and doing research in the clinical field of head and neck oncology. I'm a radiation oncologist by profession. The final topic I'd like to discuss is regarding the HPV vaccine. Does it protect against head and neck cancer? And I think that there's early evidence suggesting yes. So currently, there are several HPV vaccines, and they have been approved for girls and boys for the prevention of HPV infection. And these vaccines are targeting at preventing the infection with the high-risk HPV subtypes of viruses. And it's already been shown that HPV vaccination of young girls before they become sexually active prevents high-risk HPV infection of the cervix and reduces precancerous lesions in the cervix of girls and women who've had the HPV vaccination. So logically, we would hypothesize that these same viruses that infect the cervix, they also infect the throat. These viruses should also reduce the infection prevalence of the infection in the throat. And this is a study that was done in Costa Rica, where they actually vaccinated young girls and young women with the HPV vaccine, and then 4 years later they checked their mouths for the virus, and they compared the women who got vaccination to those who didn't, and they showed that in the females who had vaccination, or the women who had vaccination, that they had a very low prevalence of oral HPV infection. So this is early data suggesting that the virus may protect against infection of the throat, and logically should then reduce the incidence and the prevalence of oropharynx cancer in general. So I think that HPV immunization of females and males should be done. I think that I know there are multiple expert panels, CDC and other professional societies that have strongly recommended that both male and females be vaccinated, and now we know that that HPV oral infection is more common in men, and oropharyngeal carcinoma is more common in men than women. And so I think that we have impetus to vaccinate all genders. There are several vaccines out there that you could use, but the 9-valent vaccine, which basically means that it vaccinates you to more high-risk types of HPV, not just 16 and 18, but to many others. That's the preferred vaccine to use. So the general recommendation is that routine immunization should be offered to girls and boys 11 and 12 years of age, and that catch-up vaccination should be offered to females aged 13 to 26 who have not been previously vaccinated. And it's important that we vaccinate people before they become sexually active. Because once they become sexually active, they're going to get exposed to the HPV, and that they're going to be at risk of getting an infection. Patients often ask me, well, this is HPV vaccination. If I have HPV head and neck cancer, should I get vaccinated? Will it help me? And there's a lack of data to support HPV vaccination of patients who already have the cancer. Because, and logically thinking about it, if you already have the cancer, you've already been exposed to the virus. So the vaccine shouldn't really improve your immunity. Your immune system's already been exposed. But there are ongoing studies where people are trying to see if the vaccine can be therapeutic. But the data so far hasn't supported as being efficacious for treatment.